I can pass it to her. Good morning.
Hi, good morning, everyone. Welcome. We're about to start. Hello, everyone, again, and good morning. I wanted to welcome every one of you and thank you for joining us. We're very excited to be here and celebration of the August is the STAR National Breastfeeding Month. So again, this is the month where we all come together to celebrate, to support, and uplift families and helping them to meet and bringing the knowledge to bring the importance of breastfeeding, and also to let you know that we're here to support you, help you meet your breastfeeding journeys. So you're not alone, and you're alone in this. Again, what this says that we're here to tell you what WIC is all about in terms of support. WIC supports our participants from many cultures, and we also in our communities. So what we do here, we support with amazing peer counselors and lactation experts. Okay, so again, in this month, WIC recognized and the whole world recognized that support that makes breastfeeding challenging possible, because there's tools, there's answers. Overall, we're here to help you, and we just need a mom and baby deciding to say, yes, I want to do this, because we're here for you. You are not going to be alone, because we're going to walk that journey with you.
Most definitely. My name is Jessica and Miss Josie. We're here as part of the WIC team to help you with this breastfeeding journey and support. We're literally a phone call away. From August 1st through the 7th, we were able to celebrate World Breastfeeding Week. The 8th through the 14th, we celebrated Indigenous Milk Medicine Week. This week of the 15th through the 21st, we're celebrating Asian American, Native Hawaiian, and Pacific Islander Breastfeeding Week. August 25th through the 31st, we're going to be celebrating Black Breastfeeding Week. September 1st through the 7th, we're going to be celebrating Workplace Lactation Week. So we definitely know what it's like to go back to work, leave your baby, and we're here to support you. September 8th through the 14th, we're going to celebrate Semana de la Lactancia Latina. So this is all coming up, and it's part of August Breastfeeding Month. National Breastfeeding Month theme, the 2025 theme is we're moving forward together. You're not alone. We're united. We're here for you. The U.S. Breastfeeding Committee celebrates unity, solidarity, and hope. This year honors the strength of advocates and organizations working to improve access to human milk and drive lasting change.
Again, our support groups are going, that WIC offers, and during our monthly support groups are in 6 languages. We have English, Spanish, Chinese, Vietnamese, Tagalog, and Thai. So it's amazing groups for everyone. And we're going to eventually create more.
Very inclusive. Today we have Facebook Live event, Ask the LC, hosted today in English from 10:30 to 11:30 with yours truly, Jessica, and Miss Josie. Later today from 1:30 to 2:30, we're going to have Cinemoms Facebook Live with Miss Wanda and Janelle. And then later today, we're going to host it in Spanish, myself with another IBCLC, Miss Maria. And tomorrow, August 21st, we're going to have from 2 to 3, the Chinese hosted by Ms. Wendy and Connie, both IBCLCs. So we look forward to seeing you later today and tomorrow.
We're going to start by asking, by just discussing this question. Is breastfeeding can be painful at first, but with proper latch and support, it can be more comfortable. Is that true? or false?
We're going to get to know in a little bit.
Okay. So as you're thinking, we'll have more answers for you on that question.
For sure. We know that once a baby starts teething, you have to stop breastfeeding. Is that true or is that false? That's another question to keep in mind. And in a little bit, once you're able to start asking us questions, we're gonna be able to clarify and share some of the tips and answers to those questions.
We're definitely going to come back. They're very, very important questions. Again, on this one, is breastfeeding on demand is only when baby shows hunger cues? Or is it better than feeding on a strict schedule? Who knows? We'll be getting back to you on this answer as well.
Another concern that comes up, or a very big question we get quite often, is pumping milk is a valid and effective way to continue providing breast milk if direct nursing isn't possible. Some moms say they'd rather not, others say it's true. Let's think about this and see, what do you think about this? So we're going to open the forum now, right?
Yeah, these are just a few samples of some questions that you may be asking yourself. But also, we invite you to bring more questions along. Any concerns, any comments, anything you like, we're going to make this possible to answer your questions, because there's answers for everything. And as long as I mentioned at the beginning, there is a mom and a baby with that desire, we're here for you to help you walk that journey for breastfeeding.
And I see some of the answers coming in already. So thank you for those who are joining and participating. Completely true. You can definitely breastfeed when there's a baby that has teeth. The teeth do not get in the way. So it's definitely something that we would need to look into. So if you're having trouble, the baby's biting, discomfort, pain, or even damage, you would definitely want to reach out and get help with our breastfeeding helpline so that we can get in touch with you and do a little bit more investigation and see how we can better support you.
Yeah, thank you, Jessica. Jessica, help me answer some of those questions if there are any other questions for me. But as we go along with this questions and answers that we're going to give, I want to take the time to answer this one question that we had for you. And it says, breastfeeding can be painful at first, but with proper latch and support, it can be more comfortable. Right. And as we all hear many times that, and it's something very valid, I hear that breastfeeding can be very painful. Moms have experienced that and have mentioned the soreness and the tenderness. And I would strongly agree to that, Ms. Jessica. I think that, as I mentioned, like any journey, it takes that practice and guidance. And so with the soreness and tenderness, I think at the beginning, part of it is somewhat true. We're not used to having a baby there suckling at the breast. So it kind of feels that way. But once again, there's good news. There's good news, and is that we're here for you. And that's why support is so important. So we have this amazing breastfeeding helpline services that we only ask you to just call and say, I need help. I'm having this issue. And we're going to be providing that number to you as well, because as I said, we have peer counselors, we have lactation consultants that we're going to be here to help you with the whole latch and positioning techniques. It shouldn't be painful after day 3, I would say, in terms of some soreness in day 1, day 2, no more after day 3. So again, pick up the phone and ask for that support and help, because there's no pain allowed, that it should continue. And if that plan that you're doing right now is not working, we're going to generate a plan B, a plan Z, even up to plan Z, to help you meet your goals and help you be successful with breastfeeding.
I always like to share, Josie, that our body lets us know when something is wrong. So pain is an indicator that something is not right.
Correct.
It's normal to have some soreness, especially in the first couple of days. But if after that it becomes unbearable, you're noticing signs of damage, trauma, then you definitely want to get help and get a little bit more assistance to help you with that journey and not progress into further damage. So making sure that you get the time, that you get the help in time, or even if you're already breastfeeding and it's been going great and all of a sudden things start to happen, that's another indicator that something is wrong. Your body is making you aware, and it's something that needs to be discussed so that we can probe, ask questions, and see what might be the reason for this all of a sudden new pain.
Got it.
And I see some of them are answering, so they're definitely joining. Thank you so much for
Awesome.
this.
Thank you.
One of the mommies did respond and said that it was completely true that pumped milk. Pumping is still a valid way of direct nursing. It's impossible. 100%, Stephanie. Yes. Thank you for that answer.
Yeah.
And then Bridget has a question right here. What about if baby is rejecting solids and only wants breast milk? That's a great question. It all depends on the age. How often have we been offering the solids to the baby? Is this a 10-month-old? Is this a 6-month-old? It all depends. And if you're really struggling and the baby's a little older, we definitely recommend that you call us so that we can do a little bit more probing, asking you questions and see what other ideas we can share to make sure the baby still gets the breast, because it's still going to be his #1 food, his or her. But then we still do want to complement with solids and help him or her transition into solids as well.
Yeah, definitely. Solids are very important after month 6. And here's WIC also to give you those guidance and support on how to introduce and make that happen possible with some great nutritionists that we're here to help you.
Oh, she said he's 10 months.
10 months. Okay, yeah.
Sometimes I know that if we let them touch the food, I know we want to feed them and spoon feed them and make, stay clean. But many times our babies are very curious, and it helps that if you are spoon feeding him, then you're able to also allow him to touch food, play with food, smash the food. Sometimes that gives them the ability of exploring, and they might be more willing to try. So if you're open to having the cute little mess happening, sometimes that helps them with transitioning as well.
Awesome. Thank you. Great. Again, great questions. What else is out there? Let's see. Let me read some more comments from Jahaira Hernandez. She says, how do I increase my supply if I'm 3.5 months postpartum and I used to have hard and engorged boobs, but I didn't always pump, and I'd wait till baby was up to early off me. But now my boots don't get hard really at times, but not like before, and I feel like I'm lost some supply and I'm losing it because I didn't feel like, maybe I'm assuming your breast full hard. So I am glad you brought that question up, because one of the things I wanted to mention is that, yes, that fullness engorgement in the beginning will happen anywhere between that day 4, 5, 6, 7, maybe. After day 8, 10, we start establishing our supply and we start feeling a softer breast. So a soft breast is a good breast. Okay, so what are the signs that let us know that that our babies are receiving enough? Those are the important parts of information you need to know, whether your baby is pooping, peeing adequately, and what's expected per each age, per age in the baby. Also, the weight gain of your baby tell us how a baby's doing. If it's receiving breast milk from you directly, we must be taking the accountability on the weight, in gaining weight. There's an expectation from baby returning back again to birth weight at 10, 14 days. And then after that, you go to the doctors maybe at 2 weeks, and then you go and have your checkups. And if the weight is going great, that's a great indication. Happy baby is an great indication. We also have breastfeeding clinics at WIC where we invite you to come in. We have great scales at WIC where we invite you to come in and get those weight checks as well, if that also helps. But once again, resuming in that question, is that a soft breast is a good breast, and we just want to know those signs of milk transfer. What do you think, Miss Jessica?
I agree. I mean, I always use this analogy, and it helps visualize that if you're at a restaurant and the waiter comes and brings you a glass of water, if I never drink from it, he's never going to come and ask me if I want a refill. Think of that with breastfeeding. If your baby's often at the breast removing milk, your brain is telling your body to constantly refill them. So you're drinking, you're refilling, you're drinking, you're refilling. After 2 weeks, just like Josie mentioned, your body's got the rhythm. Your body knows what to do. Your body has read on your baby's demands. So it's a constant flow. So you're not actually supposed to feel hard and full. When we get hard and full, we can actually do the opposite. We're telling our body, our brain, slow down. We're already full. Our glass is full. Do not give me more milk, because it's going to prevent you from engorgement or feeling hard. Your body learned to not go all the way to the top to make you feel full and uncomfortable. because that hurts. So the body's message is, don't overfill these breasts. It hurts. Let's lower the supply. So the only way to continue with great supply is feeding on demand and feeding without the feeling of fullness. As long as your baby's feeding, like Josie said, gaining weight, having the proper diapers, then you're good. There's no need to feel pain or feel full breasts.
Okay, as Jahira mentioned, can I bring my supply back? I think it's based on supply and demand. Keep having that weight, just come back and fill up your cup.
Yes.
Refill it.
Keep bringing the
Awesome.
baby off
Great
to the
analogy.
breast.
Great analogy there. Okay. There's one more question from JC, and she says, can we touch on being sick and breastfeeding?
Sure.
I'm currently sick and co-sleep with baby, but I don't want him to get sick. I mask up, but not sure if I should
Oh, I
dip
love this
into my
question.
freezer stash to avoid getting him sick.
Beautiful
Wow.
question,
It is.
JC.
Yeah, yeah. So again, I'm glad you asked because we're coming to cold season again. And so one important information to know is that what we have in our breast milk is great antibodies and viruses that protects that we're already fighting against it, right? We're fighting so we can get better and well. So what is it that you give your baby through your breast milk? It's also those protection factors that provide the immunities to fight against that virus and bacteria. And what I have seen, Jessica, and many families have shared this with me, that many in the household, everyone gets sick, mom, dad, kids, grandma, everybody. And baby will probably get sick maybe, but very mild and recovers fast, or not get sick at all because it receives those viruses and protections against that. So no need to go to your stash. More important, your stash you already fighting, so you need to go continue with the breastfeeding if the issue is the cold and flu. Again, it can be different situations in every time, but if it is your case, Ms. JC, no need to. So we hope that you feel better soon. You're recovered. Continue with your breastfeeding journey.
That's great. I think exactly what Josie said. I think what you're already doing is exactly what your mother instinct told you to do. Mask up and feed, because your body, like Josie said, is making immunity and your body's already fighting your cold. So guess what happens to your breast milk? It becomes supercharged with antibodies to protect your baby from getting sick. So your stash doesn't have any antibodies that are extra for a cold. Your body does. So feeding him or her exactly as you've been is perfect. Save the stash for an emergency. Being sick is not an emergency. Also, the opposite, Josie. When our babies get sick and we're not sick, let's say your baby caught a cold from another person and your baby latches the saliva backwash into your breast will read that your baby is in need of extra immunity because he or she is fighting a cold. And the beauty about doing the latching is that your body's going to pick up on this need and it's going to give your body the extra immunity needed to fight your baby's cold. So even if you're not sick, your baby will still get extra boost. If he or she has a cold, your body reads it. So latching is never, ever contraindicated. If you're sick, if you have a stomach bug, if you've been vomiting, if you have a fever and you don't even know what's wrong, your breast milk does not go bad. And if you have questions or you want to discuss more, please call us so that we can go into more depth with whatever may be happening, but don't stop breastfeeding because we're sick and still continue.
Thank you, Jessica. Thank you for elaborating more. And my next question says, my baby is only 3 months and I like to boob but feed her more. Any suggestions, please? Meaning like you wanted to continue or restart, initiate breastfeeding. Everything again is possible with the whole perseverance, dedication, patience. In your situation, again, call us back and give us more details. What is your situation on that question? But again, resuming breastfeeding can be possible with good support, dedication, and patience. Again, there's
more exposure too, right?
Exactly.
If there's been a lot of bottles for many reasons or anything, I know that taking 2 or 3 days to really focus on what you desire and letting the baby explore and expose, especially at 3 months old, you can definitely dedicate a few days, if possible, to breast exploration, letting him or her just be at the breast, smell on cue, honeymooning the breast. And many times it drives them to go back to the breast flow, because many times what they're preferring, or seems like they're preferring, is the fast flow of a bottle. So if we let them explore, sometimes it can happen where we can transition them back to the breast a lot easier.
Awesome. Yeah, thank you. Thank you again. What Christina is also confirming that, yeah, she was sick and she continued with the whole breastfeeding and sanitizing her hand and continue masking. So she, awesome for confirming that information, Christina. We have another question from Stephanie. Would you mind reading that
Sure.
one for me?
I'm 5.5 months postpartum and was making 40 to 60 ounces per day, not including direct nursing. I noticed a dip in the last 3 weeks where maybe I make just under 40 ounces a day. Is it expected, or am I doing something wrong? Should I be pumping middle of the night? I drop right there. I dropped one more session since baby sleeps through the night. How old is your baby? I think Stephanie, how old is your baby? I mean, 40, 5.5 months. I'm sorry. That was in the beginning. It had
Yes.
blocked me. I mean, right now your baby's about to start solids, and 40 ounces is already quite a lot. I'm not sure if you started your cycle, if there's been a change in your hormones, if there's been, sometimes there's a little bit of stress going on for different situations, but no, your supply with 40 ounces, I know you worry because of what you used to see, the 60 ounces a day, so 20 ounces sounds like a lot. But see what changed if dropping that one pumping session or feeding changed. But you're not doing anything wrong. 40 ounces sounds like a great supply. Plus, the baby is soon going to start with complementing solids. And even if it was just breast milk, 40 ounces for a 5.5-month-old is more than enough to cover the day.
Awesome. Great. So awesome. Great. So great amount of supply there. Yeah, amazing. Okay, and that's usually the not the most average that I would hear. The average of a mother making milk is in 24 once it's already established is anywhere between that 24 to 30 ounces. So this is not so much the average, but again, good for you. So I have another question that's a great one, and I think the question about being sick and breastfeeding was very popular. A lot of our participants are liking that question came along. But there's a question from Samantha that asks, does the milk come out of the breast at the same speed as bottle? When I latch my baby, he can be at the booth forever and can be at the and never seems satisfied. But when I give him the pump milk in a bottle, he drinks it fast. Okay, well, I'm glad you asked that, Samantha.
How old is the baby?
Again, in terms how old is your baby, it's important, that for us, how old is the baby is a foundation question, because based on the background, based on the age of your baby, we will give you the background information. But I just wanted to generalize and answer your question. Like at the breast, once your milk is established, your flow is not the same as the bottle like this when you put the bottle like this. Okay, one of the biggest advices and recommendations we give here at WIC is to do pace bottle feeding by putting your baby's bottle at a 45-degree angle. So this is what imitates the flow that comes from the breast. So pace bottle feeding it really helps for baby to get used to that rhythm, right? So again, never 90, more 45, and your baby will get adjusted to that. But a baby got used to the faster flow, probably that's what the baby's asking. Mommy, I gotta go play, so let's do this fast, right? But there's a purpose. There's a purpose for baby to feed from the breast directly. And again, just let's try to practice this. What else would you like to add there?
Wow, I would really, it definitely makes a difference to know how old is the baby. If this is a 2-week-old, if this is a 6-month-old, it makes a difference. But definitely when we bottle feed, we do recommend pace bottle feeding so that we don't accidentally overfeed the baby also. Our babies are meant to suck for comfort, and they typically recommend to be at the breast anywhere from 50 to 30 minutes on each side. That would be ideal for a newborn baby or a new baby under 3 months. They typically take a little longer because of their high suck needs. They're learning to adjust to being out of the womb into the world. So to them, sucking is a soothing mechanism. I'm hot, I'm cold, I hear that loud barking dog or something. And to them, sucking is, even if it's non-nutritive, they're not hungry, they want to go often to the breast. So feeding on one breast would be expected. 15 to 20, even 30 minutes would be normal. Burp him, try to wake him up to offer the second breast, and then let him or her be the one to refuse the second breast, or how long into the second breast before he or she lets go on her own. That would be expected.
Yeah, thank you, Jessica.
Mhm.
Something else that I'd like to add into this question is there is something magical in breast milk that I mean, I just there's no doubt that I believe that this is the perfect way of feeding your baby. Well, it's either at the bottle with express breast milk or breast milk from breastfeeding directly. But when you breastfeed directly, Jessica, there's hormones, there's components that comes from my breast to the baby's stomach that communicates my baby when my baby is satisfied. This is the satiety hormone that communicates, and baby can tell that, you know, I'm done, I'm satisfied. Therefore, sometimes when we are using the bottle, we might have an opportunity to overfeed our babies.
Yeah, we
Right,
can miss it. Mhm.
by miss that the feeding cue that baby did not, you know, just said I'm done. Okay, thank you, Jessica.
Mhm.
Let me continue with the next one. It says, wow, Christina says, so should I stop breastfeeding my baby at night? The pediatrician said I should because it will cause cavities. He has 7 teeth now, and he's about 10
He
months.
probably needs you even more because of the discomfort when they're getting their little sorry, I jumped in. When they're getting their little teeth or molars, that's uncomfortable. So remember, breast milk has oxytocin, and that helps with pain. Think of oxytocin as the baby's Tylenol in a natural way coming from the mother. If I'm a baby and I know that my mom helps me with pain and comfort, I'm going to want to go to her. And that's part of that bonding. So, I mean, I know the pediatrician meant well. I'm not going against him, but I know that in the world recommendation for breastfeeding, we feed on demand. And if the baby's looking for the breast for comfort or feeding, I wouldn't deny it. Imagine that would be a crying spell, and it's not bad. And he or she has the control to do non-nutritive sucking. So it's not necessarily going to always flow milk. He's 10 months old, so he knows how to suck for real removal of milk, or I want to be close to you, mommy, because I need a few droplets.
Yeah. Thank you, Jessica. What about the part of the cavities? I mean, how is, I guess mommy's also worrying about the sugars and breast milk and the cavities. What would you say on that part?
It all depends. I mean, you can always go in with a little gauze in the morning, make sure you keep his teeth clean in different ways that won't impact, it could be done in the morning. It takes hours before it takes days before it really turns into a cavity. So if you're on top of, with your finger, a little gauze, just water and wiping, you're going to be able to keep healthy teeth without having to interrupt breastfeeding for his needs.
Right, right. And again, the sugars and breast milk are different than the sugars from the bottle.
Correct.
Yeah, so there's definitely, I would agree to your answer, Ms. Jessica. So we've also been providing the breastfeeding helpline number. It's there. So please make sure you write that down because we can elaborate more on your questions.
If they're not seeing the chat, it's 888-278-6455 from Monday through Friday from 9 to 5:30.
Awesome, great. So again, we have more questions. How can I start a freezer stash? I will be going back to work next month and I don't have a freezer stash. I get about 3 to 6 ounces a day if I do pump. Also, my baby's only wanting to bottle feed during the day. My pump breast milk and not nurse, but I want to pump to stash, but he cried and refused the breast during the day and only nursed at night. Yeah, stashing important. It's important to get that background, your reserve. So when you go back to work, so we still have some time. And yes, and every case is different, but yes, there's ways that we can advise to start pumping a day to start saving that milk and put it in the freezer at least a week or so before we go back to work.
She
Supply.
has a whole month, right?
She has a whole month to go back to work. Yeah, so
If you're able to bank, I
yeah,
tell them bank 2 ounces every day.
yeah.
Bank it. Like It's in a bank, it's in a deposit. I'm hiding it 2 ounces. In 30 days, you have 60 ounces. That's way more than enough to go back, even for that first week. Because remember, when you're at work,
Yeah.
when the baby would be, it would be a feeding time, you're gonna replace that milk with a pumping session. So if I say, if you can afford to bank 2 ounces every single day as do not touch and it's frozen, in 30 days, you have 60 ounces. Is that doable?
Yeah, definitely make that happen. So we can we can start reserving, especially when you think ahead like this. You still have a month. We can make it happen. And again, help me read the next one, Jessica. My baby is only 3 months old.
Oh, here, I'm sorry. Let's see. My baby's only 3 months old and she prefers the bottle over my breast. I think it's because she's in like the way she doesn't like. I think she's meaning, I think it's because she's like the way my breast milk tastes or doesn't like the flow of my breast. It might be slower than the bottle. Do you have any suggestions on how I can have my boob more than the bottle? How the baby can like the breast more than the bottle? I see. It depends. It's definitely exposure. Didn't we answer this question? We
No,
think
it's a different
it's
one.
a different one,
Yeah,
similar, huh?
but again, it's all goes back again to the paste bottle feeding method
Yeah,
and getting the
and
baby.
exposure to the breast. Let the baby skin to skin. It's never late. Feed the baby a little bit, maybe with the bottle, 1 ounce or 1.5 ounces per exposure to the breast and see if she can come and finish at the breast. But definitely exposure to being at the breast.
Yeah. Even doing skin to skin, starting back again to the skin to skin mechanism, which is an amazing power of love to make that happen. Yes. And Jessica's asking, what are some suggestions on food items or drink to help producing more supply? Number one, the key to success to make more milk is removal. Remember, supply and demand. So again, it's the 10 or more times in 24 hours is what we recommend. And so by you drinking enough water, enough fluids to satisfy your thirst, it's important. Just by breastfeeding ourselves, we are getting very thirsty. So make sure you always have anything that satisfies your thirst. Meals and drinking, it's just, again, your meals a day, your 3 meals a day, 2 snacks a day is what's recommended. Is there again, that is the key to success, to make the milk supply increase, and latching that baby onto the breast or removing milk by pumping as well if you're not latching. Because again, the whole goal here is that we also want to find out more details on what's your situation, who is your baby, what are you doing in terms of elaborating more on your question specifically and make it an individual plan. We would need to talk to you. We would need you to call us at the helpline and give us more information so we can assist you better on that. Okay?
Yeah. We
Awesome.
wish there was a magic something, but there isn't. It's supply demand.
Supply and
She
demand.
has a question right here regarding exclusive pumping. Sorry, let me see. This mommy Zuli.
Okay. Go ahead.
I am a 5 month postpartum and I'm a full-time pumper. I pump every 3 hours and at night every 4 hours. I get 5 to 6 ounces per session. And during my period, I only get 3 ounces per session. My question is, since I am not breastfeeding directly, may my milk dry up eventually? I have tried breastfeeding since he was a baby, but once I gave him a bottle, it's been a nightmare getting him back to my breast. Oh, I'm sorry. He cried and pushes me away now. I have accepted that I'm a pumper and I do my best to pump every 3 hours. Is that what you said?
Okay.
You are doing fantastic, Zuli. Your milk will not dry up. It's exactly what Josie said. Demand supply. If you continue on your beautiful schedule up until the time you desire to stop, that's when your body's going to get the signal. The only way the signal is telling the brain not to make milk, if there's no removal happening, then the body's getting the message, okay, I think we need to slow down on milk making. And the reason why it drops during your period, it's because of the hormones, but it goes back up as soon as your cycle is over. Totally normal. But no, the good news is if you keep this beautiful routine, you're going to be successful at continuing as long as you don't get to, well, I couldn't pump because I was at my friend's house or we were on the road and I couldn't pump for X amount of hours. When we accidentally start to interrupt the cycle of pumping, when you're a full-time pumper, that can be much more challenging, that you could fall into that dip because you're interrupting your schedule. As a pumper, that is one of the things that you do need to stay on top of your schedule to continue your supply. Good job. Props to you.
Thank you, Jessica. Thank you. Jessica, Mr. Larry Han is asking, how can I best support my wife through her breastfeeding journey?
Oh, I love this.
Awesome. And dads can definitely, mean a lot into that support. And so again, helping the mom with a good massage, right? Definitely. That's also always helpful. Maybe burping the baby, changing the baby, passing the baby on to mom. And that emotional support, it's so important. So again, as long as you're both on the same page in terms of this whole journey, it's important that you can do all the other parts of being there for her.
Yes. Thank you, Larry, for asking this question. And props to you for being that dad.
Yeah.
And that breastfeeding, it's not just one-sided. It definitely takes a team. And I think that my best advice to you would be to ask her, honey, or whatever name you call her, how can I support you? What can I do to better make your journey or for you to take the stress off of if you're breastfeeding? Do the dishes need to be done? How do I do laundry if I've never done laundry before? It can mean many things. I can say it's laundry. She can say, you know what? If you just let me go to sleep for a little while after I breastfeed. So the definition to that can mean a lot of things to different women. So asking her how you can best support her, you asking her is already support, knowing that you're that supportive husband. So great job on that.
Yeah, great answer, Jessica. Yeah, asking her is a very important part of this whole journey. What can I do for you? Awesome. Thank you. I have another question. And again, we have been receiving a lot of other comments of thank yous and also confirming to other moms their questions and how much this has helped them. But this one, it says 9-week-old baby seems to fit so quick. It's like she's on there for 5 minutes or less sometimes. Is that normal?
Mm.
Wow. Well, because of that age, maybe again, the signs of milk transfer are there. Babies gaining weight, babies is satisfying their needs, content baby. You're seeing all the signs.
I'm looking at the word sometimes though. So I wonder if that's like during a growth spurt or if it's snacking during the day because our babies do get thirsty. So if it's not every feeding and there's times where like, girl, you ate 30 minutes ago and you want to eat again and she does a 3 to 5 minute feed, those are completely normal. They're little snacks or they're thirst
The clusters.
quenchers and they're clusters. So
Mhm.
if it's sometimes, that's definitely normal. The word sometimes is what got me.
Yes, and so yes, in some feedings again, babies will just do that little bit of a cluster. Sometimes it'll be longer times. So again, the suggestion here is feed on demand and listen to your baby's needs, because there's not a clock that I think it was a question that I had asked at the beginning. Is breastfeeding can be when the baby only shows signs of hunger? And again, one of the most helpful things to know is that babies actually feed when they follow their lead instead of us just doing our schedule, right? There's no such schedule that we have to do. So hunger cues, turning, again, what they're doing, turning their head, licking their lips, putting hands into their mouth. It's just adjust to the baby's needs, attend to that demand. So again, yeah, definitely. And we just want to recognize that a late hunger cue is crying. So we don't want to get there, but attending to the needs and not leading a schedule.
I've heard sometimes moms that when we share with them prenatally or they know what to look for, they're like, you know what? Yeah, my baby doesn't cry. He or she just makes these weird noise, like grunting. Like I'm like, oh my God, your baby learned that he or she doesn't need to cry to be fed. So when many times I hear, well, I just wait till she cries, I'm like, well, think about it when you're hungry. What if you didn't eat until your stomach was really bothering you because you're hungry? You learn you learn to listen to your body, but they have no choice. They really have to wait for you to be able to pick up on that. So if you learn to pick up on your baby's body language or hand signals, that's him or her telling you, mommy, I'm kind of getting hungry. And we don't need to have that crying baby or upset baby. And they're less likely to cause trauma to the breast and all that, especially in the early days, because they're going to be aware that mommy knows how to read me and I'm ready to feed. So hunger signs, yes.
Yeah, definitely. Thank you.
Ah,
Yes, we will have it en español.
Yaras, a las 2:30, ¿verdad? El día de hoy, a las 2:30, entre a Facebook con esta página de WIC, PHFE WIC, y estaremos en español.
Okay. Another question from Esther. Jessica says, how long can milk stay out after being taken out of the fridge? Good question. So again, once it's taken out of the fridge, it was in the refrigerator to be fed to the baby. You only have that 1 hour or two max, to use it. Again, very, very important that we use it right away. And just this gives me an opportunity to tell moms that breast milk, freshly expressed breast milk out in the
Counter.
counter temperature, it can last 4 or 5 hours. In the refrigerator, 4 or 5 days. In the freezer, up to 4, 5, 6 months even. And so again, once you bring it from out, you want to use it within the 1 hour or two max.
Yeah.
Okay.
And if you're from freezer to refrigerator, it's thawed. You have 24 hours to use it. But yes, if it's from the fridge to bringing it out, you have 1 to 2 hours max to use it.
Awesome.
What does that one say?
Okay.
The day together or keep them separate? Oh,
Can you mix breast milk from different times or pump through the day together or keep them separate?
yes, you can mix them as long as you know the expiration date. So what I tell moms is like, well, I'm going to mix yesterday's milk with today's milk. If you're going to use it right away, it's okay. The reason why we like to separate them is because we know when that milk expires, right? The expiration date will change, but totally okay.
Okay, awesome. Thank you. Amazing questions here. Amazing questions and comments, and lots of support from in different moms and among all of you guys. Our participants are really agreeing to many of our statements. So again, I have another one here. I've done exclusively breastfeeding, but went back to work. I've started to pump, feel that I'm not producing enough, and also don't know how often do I need to keep producing for my 4-month-old baby.
Good job.
Okay.
Pumping is a whole other journey, but it's definitely doable.
It is. It is. It is. Awesome. It's definitely, as long as, we have great pumps here at WIC as well. We have personal pumps. If you're a WIC participant, you are entitled, if based on needs, we're entitled to issue one for free. They don't need to purchase one clinics.
One little tip I can share with you, Shady, is if when you're working, take something that smells like your baby, a blanket, a piece of clothing. If because you're not looking and stressing. Look at your phone, see pictures of your baby, try to have a good emotional state when you're pumping, and it's going to help. I mean, you're worried, you're stressed, is my baby okay? It's a change in your atmosphere, it's a change in your routine. So a dip in supply is very normal in the beginning when we go back to work, but if he's well, he or she is well, take a picture, slideshow, look at him, FaceTime if you're able to, whoever's taking care of him or her. Can I FaceTime with him or her? Can I see how's it going? Smile through the pumping process, cover the bottles, and smell something of his or hers. And you're going to see that in a few days, your body's going to respond and get back to where you were before, and your supply is going to show the benefits right there of what you're doing.
Awesome. So let's make oxytocin work for you, that love hormone to start helping us bring the milk down. Right, Jessica? Awesome. Okay, I have another question. Our time is running, but keep bringing those questions. We're still going to be here for another 10 more minutes. But how can you mix breast milk from a different, no. How much water should we be drinking a day to produce a good supply of milk? I again attend your needs for satisfying your thirst. It can be as much as for each individual needs. Again, we're all differently. It all depends on your needs. So just be attentive to the need of supply.
Drink to thirst.
Yeah.
You're thirsty, drink water.
Yes, you are also burning good calories, 300 to 500 calories in 24 hours a day as an exclusively breastfeeding mother. Another reminder that brings me to share with all of you is that if you're exclusively breastfeeding from birth to up to 6 months, your baby does not need any water. You drink the water because you're making your baby is receiving about 87% content of water through your breast milk, and also the fat content to satisfy his hunger, his needs, and his gaining those calories.
That's a good point, because right now that summer's starting, I get a lot of those questions. Do I have to give my baby water because it's hot? 2-month-old, 3-month-old? No. direct breastfeeding, your baby has all the water that it's gonna need. And even if it's a formula-fed baby, no water should be given. The water content is already in the baby's milk.
Correct.
No water to babies under 6 months old.
Right. After 6 months, correct. Awesome. Thank you, Jessica. So again, let me see if we have more questions. I was providing more from the doctor. Thank you. So again, I've been reading that after 6 weeks, you can really increase milk supply. You can't really increase milk supply. I'm worried that as baby gets bigger, I won't be able to keep up my baby full as he demand increases. Good question, Erica. Good question. We do have what they call the window frame time. And these critical days are so important in the beginning to establish your supply, the needs for your baby. Again, if the first 10 days, every day, day 1, day 3, day 10, it's a different expectation. You're working on increasing your supply. But going back again into Erica's question is, you will work on your establishing your supply 10 or more times in 24 hours. Hopefully, if there's any issues, any problems, any concerns from day 1, now your baby is 6 weeks old, you can call us and let us know what's your situation, and specifically what's your worry in terms of making the needs for your baby. But there are certain needs that baby needs per 24 hours based on their current weight. And that's always the highest weight.
I want to add to exactly what Josie said. I would like to add that if you've been already exclusively breastfeeding, you're meeting all of your baby's needs. This is where growth spurts are very important to allow your baby to ride out growth spurts. Growth spurts are when a baby's gaining weight and growing, and he wants to cluster feed often at the breast. Like, oh my God, I don't know, I've been at the breast 16 times today. I don't know, he just wants to feed so often. That's a growth spurt. Guess what happens to your milk supply if you allow the baby to come to the breast every single time he's wanted to? Your supply increases. Why? Because the demand of your baby went up. Your brain was being told, make more milk, there's more need. Guess what happens to the supply? So yes, mama, if you're doing well with breastfeeding and you meet your baby's growth spurts needs, allowing him to feed on demand, your body's going to respond to your baby's increased needs of milk. So listening to your baby's cues are going to keep your body in line with the demand of milk that your baby will need. This is why moms breastfeed for 2, 3, 4 years or longer, because they've been able to continue feeding off of your baby's demands. Your body can do it. It's you and the baby working together. He wants it, he gets it. That's the secret.
Yes. Supply and demand. And early intervention, Jessica. It's always
And it's in doubt, call for sure.
in doubt, call. We're here for you. We've provided the number to you several times today, again, to call us for that support, that question. Never keep that to yourself, because we're here and there's answers for everything. So growth spurts is so real. I mean, having this anticipatory guidance and knowing when it happens, what to expect with this is so important, because this is where moms don't know what to expect. Is when they just go into a, to the bottle, because that perception is so big here. But in reality, what's really happening in the milk supply is different. So again, seeing the signs of what's happening with your baby, and all the good signs that we've been talking about us today. What else? What other questions do we see that we need to Stephanie Gonzalez, you want to read that one?
Sure. At 5 months postpartum, are we still burning about 300 to 500 calories a day from breastfeeding? Does it decrease as the baby gets older, breastfeeding for a longer age? For example, breastfeeding at 12 months versus breastfeeding now? It can change, definitely, depending on how the demands of the baby are. But I know we hear a lot of that, right? Our body's definitely burning because you are making the milk. So yes, your body's going to be making milk, using those calories to provide those nutrients to your baby. So it doesn't change. It's the amount of times that the baby goes to the breast. It depends how often the baby is at the breast. And also some moms will say, I'm losing weight, or I've gained weight. your body is burning 300 to 500, but then make sure that we make the proper choices of what comes in because we want to make sure we make healthy choices. If you're looking for weight loss, then making sure that we plan our meals or kind of see what kind of calories are going to come back in will help you with weight loss. But as far as what your body is burning, that's correct. It stays the same as long as we're breastfeeding. Doesn't matter the age. It's how often the baby's removing the milk. Breastfeeding one time a day is not going to burn 300 to 500 calories. It's if we're breastfeeding full time, right? So it depends on the quantity of times that we're breastfeeding.
Awesome. Great. Well, Jessica, we have had amazing questions. We're almost towards our last 5 minutes of our session today. And again, just to again tell you that thank you for celebrating with us the month of the lactation, breastfeeding worldwide. And we still have a few minutes in case if you have more questions, but in doubt, there's no doubt that this is the best. This is the best that the support that you have here to make, happen breastfeeding. And a little bit of what the recommendations are is the American Academy of Pediatrics are recommending for a minimum of 2 years to breastfeed your baby. The World Health Organization is also there with us, the same recommendations. But what is indeed recommended for breastfeeding, Jessica? What is it that we say? Is again mutual agreement, right?
Mom and baby.
Mom and
Mom and
baby.
baby make that decision. I know that there's a lot of interference, whether it's good or bad, but many times I hear moms, well, they keep telling me if I'm still breastfeeding. And I'm like, what do you want to do? She's like, well, I like to nurse. Well, continue nursing. It's your baby. You decide. It's your body too. So, I mean, the recommendation is 2 years, but the longer we do it, we know that our multiple benefits to continuing to breastfeed. The bond, security, the baby's confidence, plus all the nutrients that they get, and their brain is still developing. So you are definitely helping that fat needed for brain cell development. It does wonders. So continue breastfeeding until you and baby desire. It's nobody else's right to tell you when to stop.
Yes, definitely, definitely. And again, Jessica, I think the the findings on more benefits on breastfeeding are coming up more and more and more. They're finding that this is so superior, amazing, powerful to continue after giving birth to your amazing, beautiful baby to continue with this great nutrition. And I feel like we still have time to answer one more last question.
Elizabeth has one.
Yeah, it says, I'm exclusively pumping. My baby will occasionally comfortably latch. She recently got sick. Is my milk still creating antibodies for her, even though she doesn't consistently latch? Does my body detect her saliva during those comfort latches? Thank you.
Yes, ma'am.
Yes,
So
yes, yes.
regardless, let's say your baby never latched, not even for comfort, your breast milk is still going to have immunity and antibodies provided for her that formula will never have. But if she latches, as your question is, yes, your body will get to read any saliva backwash into the nipple and make milk with a little extra immunity. But that's nothing that we really have to worry about. That's us just knowing, and we're giving you kind of behind the scenes access. Just continue what you're doing. You're doing fabulous. Exclusive pumping is a whole other level because there's just a lot more to do, washing, storing, all these things. So props to you, mama. But yes, and don't worry about that. Keep doing what you're doing. Your baby's protected regardless. You're doing a wonderful job.
Awesome. Awesome. We're asking also is also by pumping, can you still burn those calories, those 300, 500 calories that
Yes.
we're talking about?
You're still generating milk. Your body's using up that energy to create the milk. Yes, ma'am. You can still get those 300 to 5. It's the amount of times that you're pumping. So remember, full-time breastfeeding is about 8 minimum. On a very slow day, it's 8 feedings. Like, well, he wasn't really hungry today or she wasn't very demanding today. 8 is the lowest in a 24-hour period. 8 times or more, yes. But yes, you can definitely burn those calories. Keep doing a great job. To everyone that joined us today, thank you so much for taking this time out of your day to hear Josie and I present to you and answer your questions. I'm sure you have many more questions that come up. Remember that once a month, we do have support groups that we join over Zoom. Moms join, ask questions. Sometimes we do one-on-ones, and there's always the beautiful breastfeeding helpline that's here to help us and support us. So use your resources. And if you're not sure what to do, where to call, we have the texting line 91997. I have a question about breastfeeding. They will connect you. Use your resources. We are here to help.
Yes, we are. We are. Again, thank you. Thank you, Jessica, for making this amazing support happen today. And again, Jessica's going to be here again this afternoon with the Spanish ones and any other languages. Please make sure you tell anyone that might benefit from this and if they need it in the other languages that we're providing. But overall, we're here for you to continue to walk that journey. Congratulations.
Question, please call our breastfeeding helpline because our time is up. Beautiful milk supply. Too much milk can also get into a little bit of trouble, but we do want to make sure we help you safely. You can't stop cold turkey. So please call us so that we can help you with that process in the proper way. Thank you all so much. Have a great day.
Thank you, everyone.
Bye-bye.
Bye-bye.